I'm Marcy Stiles. Millions of people in the United States have diabetes, and most of them suffer from type 2 diabetes. While there is no cure, there is a program for type 2 diabetics. It's an approach that can lower and stabilize blood sugar levels and help a person lose weight through diet, exercise, and supplements. I'm here today with Dr. Jade Malay in her beautiful office. Thanks for having me.
Thanks for coming.
Can you explain why type 2 diabetes is increasing in such epidemic proportions?
Sure. Type 2 diabetes is running rampant in the United States, mostly because people who are told they have diabetes are never given complete instructions of what to do once they find out. Most people go to the doctor's office, a simple blood test is run, and then they're told they have diabetes, they're given a medication, they're told to watch their diet and to exercise, and that's really the only instruction that's given. In the meantime, while someone is following their doctor's instructions, their blood sugars continue to rise, and people are frustrated because they don't know what to do and they don't know where to turn.
So how are you able to help people with diabetes?
So what we do here in our office is we try to really identify what is causing or driving someone's diabetes. So most people don't even realize that there are actually 4 organs that are responsible for controlling your blood sugar levels. And those are the pancreas, the adrenal glands, the thyroid, and the liver. So here in our office, we run exhaustive testing to see exactly what may be causing someone's diabetes, and then from there, customize a treatment plan, especially for them once we know what is driving their disease.
So you're looking for the causes and not just the symptoms.
Exactly. I see people's diabetes like an iceberg. So when you look at an iceberg, what you see above the water is very small in comparison to what's below the water. So what medication is doing, it's artificially lowering the blood sugar levels. It's addressing what's above the water. But here in my office, we work on what's below the water, which is usually much larger, much greater than what's above the water. Once we're able to identify someone's diabetes, we customize a plan especially for them, because not every diabetic presents the same. And so it's silly to give the same medication or the same treatment for every diabetic. So here we want to identify what may be driving someone's diabetes. For instance, people may have certain food allergies or different things that is causing their blood sugars to raise so high. So those are the types of things that we want to identify and treat through diet and natural supplements, and then we start to see the blood sugar levels start to fall all on their own.
Really, what I have heard from people I know and from our discussions is that most medical doctors that tell people that they have diabetes, they're not really telling them what to do, except take this medication.
That's exactly right, and I meet with those kind of frustrated people all the time. Most people, as I said earlier, are told they have diabetes, and then the rest is left up to them to try to figure it out. And so people are left frustrated, not knowing what to do. A good example is I had a lady who was on medication, and her doctor had just had the discussion with her that she needed to start considering to be on insulin. And she came into my office and she had a great fear of needles, so she did not want to be put on insulin. That was her motivation for coming to see me. So we worked with her, we worked her up, we checked her out, and we customized a plan especially for her. And when we started, her triglycerides were off the roof, her cholesterol was very high, her blood sugar was very high. And very quickly we were able to turn her around and get all these levels to naturally drop. And about 3 months later, she visited her medical doctor, and her medical doctor was able to take her off the majority of her medication. And now she's a very happy, vibrant person. She has energy where at one time she did not. She was able to lose weight without even trying. So she's one of our great success stories.
That is a great success story. Now, you have very strict standards of who you accept into your practice. What are you looking for?
That's correct. We want to work with people who are motivated to take care of their health. Obviously, I can't care more for someone's health than they do. So I'm looking for someone who is willing and ready to make a change, because we will need to make changes because what is currently being done isn't working. So I'm needing someone who is dedicated to their health, who wants to find the cause of their problem, not simply just put a band-aid over it, because that's what medication is doing. I need someone who doesn't want a quick fix, because again, that's what medication is doing. I need someone who wants to find out the cause of their problem, treat it, and live a happier life because of it.
Great. Well, I will tell people how they can get a hold of you. Thanks for being here.
Thank you.
If you would like to see if you qualify for a free type 2 diabetic consultation with Dr. Jade Malay, call in Carrollton 972-492-0383 or her Dallas location 214-599-9285. Or if you're not sure and want more information, feel free to visit Dr. Jade Malay's website at www.type2diabetessolutions.com. Thank you.